So with this evolving COVID pandemic, I've seen a huge influx in the number of people contacting me, whether they be current patients or new patients that are finding it extremely difficult to cope with the emotional distress of wondering themselves about whether they actually have the virus themselves, and also whether they'll be safe through this crisis. And making mention of the fact too that this has come on the back of the bushfire crisis. A lot of these doctors still haven't been relieved from their duties during that time. I do fear that there will be a huge mental health crisis after this across all of our frontline workers, paramedics, nurses, doctors, everybody on the front line. I think that one of the most important things to consider is that doctors are human beings too. Doctors have families, and doctors also can sometimes have chronic illnesses. We're not immune to disease and illness. So I actually have a couple of people in my practice that have chronic respiratory conditions at the moment and are absolutely terrified that they're going to catch COVID. And with their medical knowledge and knowledge from the inside of the profession, knowing what it's like to go to ICU and be intubated because maybe they have been in the past, to have that realistic fear that they may need to do that again is crippling for them. Be upfront if you have symptoms. Do the right thing. A lot of the doctors that I've seen, particularly GPs, who are they're self-employed people, they don't get sick leave. They're reporting repeatedly that people don't declare symptoms, don't do the right thing, and come and sit in GP waiting rooms and tell the doctor once they get into the room, oh, by the way, I've just come back from overseas. These doctors are underprepared. They don't have resources. They have one mask per shift. They don't know which patient to use the mask with. This is actually happening. So if we could all just stick together and recognise that doctors are under incredibly terrible stress at the moment, to be respectful, to wait your turn, and to be honest about if you have symptoms. I recognise how hard it is to feel connected still in a community where things are being shut down all the time, but maintaining as many things that you can do yourself around self-care are hugely important. Things that are as basic as making sure you get sleep, talking to friends as much as you can until the pandemic is over. But the other thing I'd really like to call for is that we have priority testing for coronavirus. Currently, my colleagues are standing in queues of 300 people just like everybody else and waiting over 72 hours for results, losing income, but also putting other doctors in terrible situations where we're understaffed in emergency departments and general practices. So I would call for absolutely that we have priority testing for COVID and that we don't go and stand in queues with the general public. Really, if people could just be nice and respectful to each other and recognise that we're all in the same position, rather than expecting doctors to be superhuman and being able to take abuse and violence, which is currently occurring in emergency departments when people have to wait extended periods of time. Please understand that we are doing our best. The motto that we all live by is if you can walk, you can work. That is still the way we feel. We still put patients often in front of ourselves and our families. So if people can just be respectful of that, it would help us as well last the distance with the pandemic.